Welcome back, everyone. Tens of thousands of people are desperate to escape the bloodshed in Syria, but a few people are working to get into the country, and some people have already made it into the country to do humanitarian work. Dr. Anas Al-Kassem is one of them. He's a Syrian-Canadian doctor. He left his practice in Simcoe, Ontario, to set up field hospitals inside Syria during what is widely acknowledged to be a civil war. He joins me now from Syria's border with Turkey, where he's gathering more supplies to take back into the country. Dr. Al-Kassem, you were there only yesterday. Where were you exactly?
Fortunately, I can't say exactly the town because it's kind of secret. We don't want to tell the regime where we're building these field hospitals. But I was very close to the Turkish-Syrian border, a little bit to the depth, around 10 kilometers from the Turkish-Syrian border.
Okay. Describe what you've seen inside those medical field hospitals that you've been setting up.
Every time I go there, the situation is getting worse. In the last month or 2 months ago, we used to see more gunshots, but nowadays we're seeing all kind of injuries, due to tanks, helicopters, aircrafts. It's unbelievable. I've seen many kids. I've seen ladies, girls who had major injuries, and we had to do, one day we had to do 4 amputations.
Oh my gosh. And we've talked to Médecins Sans Frontières before. They can't get in. As we understand it also, some doctors and nurses have left various areas of Syria. What kind of ability do you have and challenges do you have in treating these people?
We have major lack and shortage of medical supplies, and this is the main challenging thing. We don't care about the risk now because when you see the bloodshed everywhere, when you see people bleeding in the streets and nobody has access to them, we have to do something. And Canadian Relief for Syria sent some physicians before, and we do this every time there with coordination with the rest of the medical relief organizations. But the problem really is the medical supplies. And we keep asking for help. We're not getting any help from governments, from the international community, from the Red Crescent or Red Cross. They don't want to get in Syria because of the risk, obviously, and we're only smuggling medical supplies literally through the border because now Aleppo is under siege. Aleppo is the hub of the medical supplies, and the pharmaceutical companies in Aleppo is shut down. So we don't have any access to Aleppo. And basically now we're getting all the wounded patients from Aleppo. It's the opposite way, and the only access is Turkey.
When you're doing things like amputations, though, what do you do for pain medication? What do you, anesthetic? Do you have at least those things?
We have major shortage of morphine, meropenem, and all these analgesia or narcotics medications. We try to talk with the Turkish government, Turkish authority. We get some supplies from time to time, but it happened a few times that we did not have anything more than oral. A kid who had amputation, we gave him only oral medications, which is unbelievable, for pain for 24 hours until next day we were able to get some IV medications.
Gosh, it sounds like Haiti. Remember in Haiti when doctors had to do so many operations and they had nothing, some cases just knives and vodka to sterilize them. It was a horrendous situation. What drives you to go from Ontario to go all the way to the border, take the risk of going inside Syria and do this?
I'm watching the international community every day, and nobody's doing anything. People just keep watching and watching. They say the regime has to step down, Assad has to step down, but nobody's doing anything. So we decided in Canadian Relief for Syria, in coordination with the Union of Syrian Medical Organizations, that we have to step in, we have to do something. So we have to do the job ourselves. A bunch of trauma surgeons and internal medicine physicians. We're right at the border. We have a hub here. We have an office, and we're smuggling the medical supplies. We keep building field hospitals. Yesterday, we went up to the mountain in Syria, and we decided with the Free Syrian Army about a good spot for the well-protected spot for a field hospital. We keep just building because the regime and Assad keep killing people. It's unbelievable.
So you're working, lockstep with the Free Syrian Army and getting them to protect you as much as they can.
Yeah, in the northern Syria, there's only Free Syrian Army, thanks God, and they're very good. They're protecting us. They tell us where to build the field hospitals because otherwise we can't work because the regime is just attacking us, and they're going to just shell the hospitals. And it happened before. We lost many field hospitals before.
Are you afraid for your life?
You know, you feel sometimes that you're scary, but when you see the brave people inside, you know, they have great spirits. They're so brave and they don't care. They just want to get outside and protest and protect their country. I feel that the risk is very minimal.
Syrian Canadian Dr. Anas Al-Kassem, thank you for taking the time to speak with me from the border of Syria and Turkey. I really appreciate it.
Thank you very much. Thank you.